My oral presentation is about children with exceptionalities and how dealing and working with children with exceptionalities is irrelevant for an early childhood educator. Exceptionality is another word for the equality or being exceptional, a condition in which a child or adult can have eventually become noticeable at a young age or an older age as well, depending on what exceptionality it is. First off, I believe that people in the work field of an early childhood educator have to deal with and help many different types of children, and this includes children with exceptionalities. Some people would see helping children or a child with an exceptionality as hard to help or hard to work with. I believe that helping a child or working with a child with an exceptionality is not all that bad. There are many different career paths for people, but to be an early childhood educator, you have to realize that there are many different things you must do and plenty of different places for you to work at, such as a daycare or school, etc. But at any of these places, you would have to be aware that you could possibly be working with a child or children with exceptionalities. Secondly, I would like to introduce you to some common exceptionalities that children are born with and or that just gradually become noticeable for them or their parents at a young age. So some common exceptionalities include intellectual and developmental differences. Includes gifted children and children who manifest intellectual delays. Sensory disabilities include blind and deaf students. Communication disorders include students with learning disabilities, those who have pervasive disorders like autism, and those who have speech and language difficulties. Physical and health difficulties include students who have genetic disorders, problems which arise from birth trauma, orthopedic conditions, and disabilities caused by disease. Behavior disorders include students who suffer from mental illness, socially maladjusted delinquent, and those who exhibit conduct disorders. What causes intellectual and developmental delays? There is a large amount of things that can cause an intellectual disability. Researchers say that most of the main causes of intellectual disability focuses on the type of risk factors such as biomedical, social, behavior, and educational. This also includes the timing of exposure such as prenatal, and postnatal to those factors. What causes sensory disabilities? Researchers say that most people were born with sensory disabilities when they are a baby is first born. It will usually take a little bit after the baby is born for the parents to see the child has sensory disabilities. What causes communication disorders? Some causes of communication disorders include hearing loss, neurological disorders, brain injury, mental retardation, drug abuse, physical impairments such as cleft lip or palate, emotional and or physical disorders, and developmental disorders. What causes physical and health difficulties? Alcohol can cause physical and health difficulties as well as different types of drugs. What causes behavior disorders? Research has shown that children with behavioral disorders are more likely than other children to have a family history, behavior problems, mood problems, or substance abuse problems like addiction. In some cases, the caregiving is lacking. Children will respond by developing the symptoms of behavioral disorders. Having a mother with untreated depression also makes children more apt to having behavioral disorders. Children with opposing defiant disorder or ODD have other mental health problems like depression and anxiety.